Chris McCarthy from the American Chemical Society. Welcome to this news briefing for the ACM 256th National Meeting and Exposition in Boston. We're joined today by Dr. Vivek Kumar from the New Jersey Institute of Technology. He's studying a biomaterial that could keep a tooth alive after a root canal. Dr. Kumar?
Hi, thank you very much for the opportunity to speak at today's meeting. So I'd like to maybe very quickly go through a little bit of our technology. So we work with self-assembling peptides. These are unique scaffolds. These are typically 15 to about 50 amino acid long polypeptides, which self-assemble, which come together on their own, kind of like biomolecules like collagen, elastin, and things like that. Now, what we do is manufacture these peptides using a process known as solid-phase peptide synthesis and put on very specific different biological moieties, which are derived from a variety of different growth factors, chemokines, and cytokines. So what's unique about the system is that instead of doping or adding exogenous factors to our hydrogel materials or to our materials, we can incorporate the signal into the scaffold itself, or as we'd like to start calling it, the medium within the message, or the message within the medium, rather. What we've demonstrated in the past is the ability to form angiogenic scaffolds, and we've published that work a couple of years ago. What we've now proceeded to do is to establish this technology and this platform for delivery of cells, small molecules, cytokines, chemokines, and importantly, as we'll talk about today, the incorporation of a dentinogenic moiety, or a moiety that helps proliferation of dental pulp stem cells, or the cells within a tooth. So what's unique about this small molecule is that it has the ability to help proliferate dental pulp stem cells. So these peptides themselves individually self-assemble. They come together, as you can see in these images here. They self-assemble into these nanofibers, as we've measured using and imaged using atomic force microscopy. These nanofibers are typically between 5 to 10 nanometers in width and 2 to 5 nanometers in height, and as you can see, several hundreds of nanometers in length. What's really unique about these self-assembled peptides is that they self-assemble through non-covalent interactions, which allows these van der Waals interactions, hydrogen bonds, ionic interactions to break easily but reform easily, meaning we can syringe aspirate and inject these peptides which reform into a bolus. So if you think about an analogous material like toothpaste, you can squeeze it out onto your toothbrush, but it doesn't just slough off there. It reforms into a solid, so it stays there. So in the same way, we can syringe aspirate, inject our materials, and that's kind of emblematically shown here when we pipetted or deposited some of our hydrogel onto this stage for rheometric analysis or rheology. And essentially, you can see that even immediately after pipetting, wherever we pulled off that pipette tip, you can see a little nubbin of the hydrogel, which is almost instantaneously re-solidified into a gel. So what we hope to do with this is use this self-assembling, shear thinning, shear recovering hydrogel to inject directly into the dental pulp. So this comes into the problem that a lot of us have faced, a root canal. So you feel that inflammation, you feel that pain in your tooth, and the first thing that you think of is, oh my God, let me find a dentist, let me try to get some pain medication in me. But ultimately, the treatment that is currently prescribed, or most commonly currently performed, is you go to your dentist, your endodontist, they remove the top layer of your tooth, the crown, and essentially they extirpate or they remove the dental pulp, the soft tissue which is inflamed, which has a bacterial infection or what have you. And typically it's that inflammation, that swelling of the tissue that impinges the nerve and causes that pain. So dentist goes in, removes the soft tissue inside the tooth, shown schematically in gray here, and essentially you're left with a dead tooth and or a canal, which is then filled with rubber rods, which are inert materials, and ultimately you're left with a dead tooth. What we say is, can we develop a injectable hydrogel material, which we've shown the platform for, which can help proliferate the stem cells within the tooth to regenerate vital pulp, to regenerate living tissue within the tooth itself. Now, this has been attempted in part for over 50 years. So initially what dentists used to do is that they go our tissue. Unfortunately, the degree of tissue regeneration wasn't that great, and you end up still with a void in your pulpal cavity. So what we're trying to do, again, just to summarize, is to create an injectable hydrogel to help regenerate or promote dental pulp proliferation into the pulpal space and regeneration of the tissue. So maybe I'll just leave it there for now.
Great. Are there any questions? And please state your name and affiliation before asking your question.
Thank you. Hi, so it's Kath O'Driscoll from Chemistry and Industry magazine. I think that the new part, as I understand it, is this ability to regenerate the dentine, is it? Because I know you've done previous work with angiogenesis. So what have you added? What peptide or part of a peptide have you added to be able to regenerate dentine, and how new is that?
Right. So if we could actually just jump back 2 slides. Sorry. Maybe one more. And one more, actually. Thank you. So, sorry. So basically, as you mentioned, we have demonstrated the angiogenic activity. What we've actually added to the base peptide, so we like the platform that we work with is termed multi-domain peptides because they have multiple domains. But very simply, you have a base peptide which self-assembles, as well as a signaling domain which was originally, in the case of the angiogenic moiety, derived from VEGF-165. So instead of taking the entire growth factor, we take a short 15 amino acid mimic, which does the trick in that sense. And what's unique about this platform is that every single peptide strand expresses that mimic. So you have very high epitope presentation in the overall nanofiber that self-assembles. Now, extending that notion, we isolated we didn't. We looked at the literature and found a mimic of a matrix, of an extracellular matrix proteoglycan, which helps with dental pulp stem cell proliferation, as well as calcium deposition of those dental pulp stem cells. So in some of the preliminary work that we did, that we published in ACS Omega earlier on this year, we showed that these dentinogenic scaffolds, these peptide-based scaffolds, in a dose-dependent manner, promote dental pulp stem cell proliferation, as well as calcium deposition in vitro. What we're doing right now, just to finish up the thought, what we're doing right now is trying to take some of these scaffolds and implant them in an animal model of a root canal. And specifically, we're looking at a dog model where we remove the dental pulp from a dog. And sorry if we go 2 slides forward this time. And in a slightly more severe version of the model that you see up on this slide, instead of taking out just a little bit of the pulp, a partial pulpectomy, what we want to do is to extirpate the pulp completely or remove all of the pulp down to the root apices, the bottom of the tooth, and essentially replace that entire pulp chamber with our hydrogel and see what tissue grows into there. I hope that kind of answers your question.
I was just intrigued by the calcium deposition as well, because potentially I suppose you could regrow the tooth, could you? Because that's the enamel as well.
Right. So I think one of the interesting things that we hope for, at least phenotypically, of the cells that do proliferate into our hydrogels is that they exhibit not just the ability to replicate some of the morphology, so some of the fibroblast or similar morphology of dental pulp stem cells. In addition to that, what we would hope is that these stem cells start to create these protrusions, also known as dentinal tubules, into these protrusions into dentinal tubules in the enamel itself, or the dentin, which is the layer right before the enamel, which is the outermost layer.
So it sort of reinforces the enamel rather than actually regrowing it, because I wondered if that could be a problem, but no.
Exactly. Ultimately, we don't know if we could completely regenerate a tooth, both the hard components and the soft components, to keep it simple. However, we do envision a strategy where we use our hydrogels to regenerate the soft tissue components and still use a restoration on top, so using mineral trioxide and a glass ionomer and a restoration to cap the tooth. Ultimately, we were having some of these discussions even before this. One of the things that we would like to do is to create a vital tooth, right? So instead of the current procedures where you come back after a couple of years because of infection in the either periodontal ligament or around the tooth, what we would hope is that after creating a vital tooth, the tooth is responsive again, so you get another chance, because I guess you get that first chance as when you're a kid with their deciduous teeth, the teeth that fall out, but I guess your adult teeth are your adult teeth.
I know the release talks about the sort of effective sort of period of action of these materials. Yeah. How long do you want it to act for? Because I think that seems to be one of the hurdles, is it? That it's perhaps not long enough acting? Right.
So one of the things that we've done in the work so my lab in general works on not just the dentinogenic versions of these peptides. We work on a variety of different peptides. We have antibacterial peptides. For example, my postdoc Biplab Sarkar will be talking about some of these antibacterial peptides. My other postdoc Peter Wen will be talking about the dentinogenic peptides tomorrow. And we've worked on angiogenic peptides, antimicrobial peptides, as well as dentinogenic peptides. So the question is, what combination of these peptides can we use in a scaffold, in a hydrogel scaffold, to help regenerate the best tissue that we want? But to answer your question specifically, we don't know exactly how long or the time frame that's required for full regeneration of tissue in this space. Now, to be fair, it is a relatively small 20 to 200 microliter space, so it's a relatively small volume. However, to be fair, this area typically doesn't have that much, those many blood vessels. And one of the first things that we would like to do is to see whether we can regenerate some of the vasculature to supply the tissue itself with blood supply. Another important factor is to prevent subsequent microbial insult. So one of the things that we'd be interested in doing is seeing whether we can incorporate some of our antimicrobial hydrogels into this construct as well. Again, coming back to the question that you asked, how quickly do we want these, how long do we want these to stick around, how quickly do we expect tissue regeneration? We don't quite know, and that's one of the purposes of doing some of the studies that we're doing right now in our beagle model, in our canine model. However, what we have seen in subcutaneous implants as well as intramuscular implants is that our hydrogels, this platform at least, persists anywhere between 2 to 3 weeks all the way to several months, depending on the structure, stability, incorporation of cleavage domains, sequences, and overall sequence that we design our base platform self-assembling domain with. Ultimately, we think that in the pulpal space, and this, your guess is as good as mine, we think in the pulpal space, having a scaffold there on the order of 2 weeks to a month is suitable in terms of the wound healing process. If you think about it, when you have, back in the day when they used to create those blood clots, typically those fibrin clots would resorb into the tissue over a 3 to 7 day period, as would a scab, for example. And not leaving behind sufficient tissue, our hope is that through our process, through our scaffolds, we can get good tissue regrowth.
How much angiogenesis have you seen? What sort of percentage improvement in angiogenesis have you seen?
So what's unique about our angiogenic scaffolds that we actually published in ACS Nano, so we got a whole ACS legacy here. No, we like ACS, that we published in ACS Nano in 2015 now. The work that we did in angiogenesis was actually really fascinating. So the blood vessels that we were creating were robust, mature microvessels. So they weren't just nascent, immature capillaries. They were 15 to 50 micron microvessels. They were lined by endothelial cells as well as parasites and smooth muscle cells. So these were mature vessels. So we were really excited about that. In fact, some of the cutting edge work that's going on in the field of multi-domain peptides by one of the pioneers of the whole field, Jeffrey Hartgerink, over at Rice University in the Department of Chemistry. What Professor Hartgerink has shown is that certain variations of these peptides, even without some of these growth factor sequences or even without some of these mimics, are still capable of angiogenesis as well as neurogenesis, depending on the overall degradations, nanoporosity and what have you of the hydrogel sequence itself. In fact, some of his recent work was published in Biomaterials earlier on this year that showed very unique aspects of this hydrogel platform. Taking a step back, coming back to the general work that we do, this is a phenomenal platform that we really think has a lot of different effects. I think one of the primary benefits, which is kind of encapsulated in this image that you see right here, one of the primary benefits is that we have a material that assembles into a hydrogel, so it's persistent, it stays in the tissue for a little while. It creates a scaffold that rapidly infiltrates with cells. So, a decade ago, 2 decades ago, when I was doing my training as a biomedical engineer, canon was that you needed 100 micron interconnected pores to have any kind of cell infiltration. What we're showing with these soft, thixotropic, shear-thinning, shear-recovering materials is that these nanoporous materials with a nanofibrous architecture allow cells to rapidly infiltrate, allow cells to rapidly populate these scaffolds and deposit their own matrix. So even in that ACS Nano paper that I referenced a little while ago, we saw collagen deposition, we saw extracellular matrix deposition in the middle of these scaffolds. So we were seeing that cells that were infiltrating the scaffolds were depositing their own matrix and creating robust tissue depending on where we implanted it. But ultimately, hopefully I can tell you in a month or two that we have some good success in regeneration of dental pulp in dogs. But those studies are ongoing.
Thank you.
Thank you.
Bela Buslig, ACS. The sizes of the peptides in there, what range are they?
The size? So, sorry, 2 slides back. Yeah, no, this is, perfect, thank you. So the base peptide that we typically work with, and this is published, parts of this is published, parts of this are filed, IP has been filed for. The base peptide typically is around 14 amino acids, 14 to 16 amino acids, and that has a molecular weight on the order of about 1,500 to 2,000 molecular weight. The dentinogenic peptide that we have discussed and that we're working with presently, I believe has a molecular weight of 4,200 or thereabouts molecular weight. But ultimately, as I mentioned before, these materials, these peptides self-assemble into these nanofibers, and these nanofibers in and of themselves entangle into meshworks, nanofibrous meshworks of hydrogels that are highly solvated. So typically we would use this in a formulation of anywhere between a 1 to 4 weight percent in a hydrogel form.
Now, the amino acids in there, I noticed some aromatics and some straight-chained ones. Presumably, this being a hydrogel, some of it is lysine and some of it is something which have hydrophilic polarity, and of course the aromatic residues help assembling,
right. So
stacking. But are all the amino acids natural L forms, or
right? So they're all natural. So they're all naturally occurring amino acids. And one of the unique things, and this goes back to some of the work again that the pioneer of one of the pioneers of this entire field and the pioneer of this specific platform, Jeffrey Hartgerink, again over at Rice University. What he's shown is very elegant design and sequence modulation in terms of how to develop these materials. But by and large, typically we've seen that ignoring this mimic domain on the side, the base peptide from here to here consists of flanking polar amino acid residues, right? So these are your positively charged lysines, glutamic acids, negatively charged what have you. The mid block of the peptides typically consists of alternating hydrophilic and hydrophobic amino acid residues. So these are your serines and your leucines or your isoleucines or what have you. And we have at least, typically we see that at least 6 repeats are required for self-assembly. And that piece alone, lysine, serine, leucine repeats, lysine, that sequence alone, that base platform, that base peptide self-assembles into a beautiful nanofibrous hydrogel. And some of the work that Jeff, as well as several other groups have shown, is the ability for those hydrogels themselves to act as drug delivery carriers, vehicles. And what my lab is specifically interested in is seeing how we can use that platform to deliver a variety of different signals. And now coming to the next part of your question, obviously there are a couple of, a variety of different aromatics, charges, and different kinds of amino acid groups in the mimics that we attach. But what we've done in my lab is to look at a variety of different ways to enhance the solubility and overall presentation, especially of the growth factor mimics, such that we have the same or comparable secondary structure in the ultimate drug that we're delivering.
Thank you. Now, one last question.
Yeah.
What's the time scale you see that this is becoming available to the general public?
The general public.
Because I think people would be lining up in front of dentists' offices as soon as this becomes available.
Right. So we're actually very excited about this technology, and one of the excellent parts of ACS and this platform in general is the ability to reach out and look for collaborators and things like that. We're very excited about getting this technology out there and into the public as quickly as possible. We believe that this is a great indication to target. We are working with. We're trying to formulate the best regulatory pathway and route. We're planning to speak to the FDA hopefully soon to establish our pivotal IND studies, as well as what are the animal models that would be best suitable. We think that preclinical work will take on the order of about 2 years, finishing up efficacy and hopefully getting some of the CMC as well as tox work done. And in terms of clinical trials, we have worked with a number of different dentists. I should mention our collaborators. Our clinical collaborators include both Saul Wiener as well as Emi Shimizu. Both of them are at the Rutgers School of Dental Medicine. Phenomenal dentists with a lot of experience. And they have actually helped guide and inform some of the work that we're doing here. Now, I would be remiss not to mention Rina D'Souza, who is quite a luminary in the field of dentistry. She was the former president of IADR, I believe, and she's been a big influence and mentor both on myself as well as on much of the work. But coming back to your question, hopefully, once we get into the clinic, 5 to 6 years of clinical trials. And ultimately, if we can get this into dentists' hands and into patients' mouths in the next 5 to 8 years, that would be I call that a success, hopefully. Thank you.
Katie Cottingham from ACS. So just one last question. So what is the advantage of having a live tooth there instead of a dead one? So it seems like if you just have something sitting there so you could chew, that's good enough, right?
Yeah, no. I think the important part is, the so what and who cares, right? And that's a big question in research in general, especially when it comes to reimbursements and the healthcare system, which I am not going to talk about. But I think one of the important things is, do you mind advancing 2 slides forward? So the ultimate goal would be, can we develop a technology that we go in, we just take out the infected part, and we put in our material, so we do a partial removal of the infected pulp, put in our material, maybe even with microbicidal effects, and we essentially regenerate the tooth right there. Because the idea is that your native tissue is the most responsive. It has the greatest ability to regenerate on its own and heal wounds on its own. As a surrogate for that, we can put in different types of stem cells, different types of scaffolds, which the community has tried doing for the past couple of decades even. And then it comes to our technologies where we try to regenerate tissue based on signals that we provide to different cells intrinsic to the scaffolds themselves. Of course, the polar opposite to that, maybe not the polar, but the opposite of that would be to fill the tooth with gutta percha or rubber rods, which is what they use right now. Ultimately, a dead tooth is not responsive, and it could ultimately lead in a tooth falling out and requiring a permanent fixture or replacement. And that's something that we want to avoid because, as I mentioned, if you can have a living tooth there that is responsive to future insult and injury, be it 1 year down the road, 5 or 10 years down the road, that would be optimal.
Thank you very much. The archive version of this session will soon be posted at bit.ly/ACSLive_Boston 2018. And please join us for our next press conference at 9:30 today on how illicit drug use could be higher than previously thought and soars during special events. Thank you.
Thank you.